Hi, thank you to Grit and Grace for having me at this conference today. I'm going to share with you a bit of who I am, my story, how I got to this place to be doing this work, and I will also share with you some strategies to manage the stress that is 2020. And if you are not feeling okay, it's okay to not feel okay. So, a little bit about me. So, about 15 years ago, I was diagnosed with bipolar disorder. And a couple of years into my diagnosis, I found myself in a hospital. Now, I, as a social worker, had worked in mental health facilities before, and it was a real challenge to find myself on the other side of the practice continuum. So I was a patient for about 7 days. While I was there, I had a psychiatrist with whom I shared, what I did for a living, and he thought it was fascinating that I was a professor, I was a social worker, and we ended up having a lot of conversation around articles that I was reading because I decided that that was the only time that I was ever going to be hospitalized, and I was going to do whatever I could to not experience that again. And so when I came out of the hospital, I came out with, I think I was on 4 different psychotropic medications. And I was very, very fortunate to have a psychiatrist who was not necessarily anti meds, but she believed that you could behave your way to a lot of health. And then what was left over, what you couldn't fix with your behavior, you medicated. And so I spent a lot of time using all the research skills that I developed as a PhD student to really research brain function and to figure out how to reduce stress. And because what I did learn early on was that stress is a trigger for a lot of mental health conditions. So even if you have um, bipolar disorder or you have schizophrenia, if you have schizophrenia, for example, it's usually a stressful moment or a stressful time in your life that triggers the first episode. And this is why, for example, people often get it around the first time that they enroll in college, etc. And so I really wanted to find a way to keep my career because what I was beginning to realize is that if I was to stay on all those medications, it would have been very hard for me to write, to do a lot of the work that I was trying to do, to even do a lecture because a lot of medications make you very sluggish. They make your brain very foggy. You can also seem a little high. I had side effects like hand trembling, which meant I had to get a stamp for my signature, and I decided to only use PowerPoint to teach a class because I literally could not write on the board. And so there were all these side effects that I was experiencing. And so as much as possible, I wanted to not have them because I was not going to go on disability. That was my goal, was not to have to experience that. Now, some people will experience that and you could do all you want and do not respond in the way that I um, found worked for me. And so out of that first experience became my first book. Now, I had no plans to write a book, even as an academic. I knew I was going to write articles, but my first book, Bipolar 101, was really about what I found for myself that worked. And my doctor actually encouraged me to write a book about what I had learned about brain function, especially as it related to ameliorating the both the impacts of medication as well as the impacts of the illness. And so Bipolar 101 became my first book. It was quite successful. I wrote another one called Preventing Bipolar Relapse, again, based on a lot of what I learned, and what I learned worked for me and what the research said would work for people in general, just on the way our brain works. And what I also realized is that the way that we treat mental illness is very much a medical model, which says, you have a symptom, you take a pill, and that's how it works. And there's actually a new book out about nutrition and mental health written by a doctor and nutritionist at Harvard. I'm trying to remember the name of the book right now, but it's escaping me. But I think it's called This Is Your Brain on Food or something like that. But what is happening now is that we're beginning to be more conscious of all the ways that our mind and body are connected. Of course they are. I tell people if you take a pill, you actually swallow it, it goes in your stomach, and it impacts your brain in the same way food does the same thing. And so for me, learning what to eat, how to improve my sleep, because what also people don't realize is that sleep is both a trigger and symptom of mental health disorders. So if you don't get a lot of sleep, you're more likely to get depressed, you're more likely to have anxiety, as well as not being able to sleep is a symptom of anxiety and depression. So monitoring your sleep and taking care of that is also really, really important. And for me, somebody who is always going all the time, what I realized is that I needed to really enjoy time off. I needed to take time to have the relationships that I wanted to have with my friends, and that working all the time wasn't necessarily the best thing. And just a little, and some of you might, you know, connect to this or it might resonate for you. I was a grad student at UC Berkeley doing my PhD. I was working as a research assistant at a huge firm in Silicon Valley. I was also teaching classes at San Francisco State, and I had a toddler. Now, it doesn't take much of a genius to realize that my body couldn't keep doing that for very long. And I strongly believe that that is what triggered my bipolar disorder was the demands that I was putting on myself. And we live in a culture where we are not encouraged to take breaks. Americans brag a lot about how much they work, and that is something that, you know, they say by um, October, we've worked as much as Europeans work for an entire year. And so we have a culture that rewards work. We have women who say things like, who brag about the fact that they, you know, worked up to day before they gave birth. And none of these things are healthy for us. And this is why we have, you know, poor maternal and child health outcomes in lots of different places. So what I want you to know is that stressing yourself out, and working really, really hard. Working hard is good, but working so hard that you don't have time to be happy, you don't have time to do the things that bring you joy. And you will start to feel the impacts. If you, when I was talking to my family practitioner recently, he shared with me that stress was the number one reason people came to the doctor. Sometimes not directly, but indirectly, whether it was for hypertension, whether it was for cardiovascular illnesses, mental illnesses, diabetes, obesity. These are all things that are highly related to stress. So I want to read a quote that I love, and it comes from Frankl, who experienced the Holocaust and wrote several books about going through difficult times. And what the quote says is, between stimulus and response, there is a space. In that space is our power to choose our response. In our response lies our growth and our freedom. So I want you to know that you might not be able to control the stress around you, but you really can control how you respond to it. And some of the stressful things that we're going through right now include the pandemic, right? It includes people who are staying home when they used to go to work. If you have children at home, you are now educating from home. Some of you might be socially isolated based on where you live. You might have fear about getting the illness. You might have experienced loss from family members who may have died of the illness, or people who went through illness but you couldn't visit them in the hospital. You might also be stressed out for lack of information. Also, to note that there is a lot of stress for people of color, and especially for Black people who have to watch a lot of trauma. And it's really, really important to take care of ourselves. People are feeling really triggered, and it feels like it's just never ending. There's just one shooting after another. There are protests, there are riots. There's a lot of racism that is blatant. People are trying to figure out, where do we go from here? Whether it's, you know, taking down Confederate things, whatever it is. And we're also finding ourselves culturally in polar distances from each other. Whatever your beliefs are, there's a lot of disparity in how we perceive the world, and there's a lot of misunderstanding. People are getting blocked on social media. It's a very, very stressful time. And so what I want to start with here is, I want us to do a breathing exercise, because breathing is one of the ways that We can control how we react. We calm our bodies down. We clear our brain. So I want you to close your eyes. And what you're going to do is you're going to be breathing in through your nose for a count of 5. You're going to hold for a count of 3. And then you're going to blow out through your mouth for a count of 5. You're going to close your eyes to shut out all the stimuli. So I want you to do that. Close your eyes. Breathe in through your nose. 1, 2, 3, 4, 5. Hold for a count of 1, 2, 3. Breathe out for a count of 5, 4, 3, 2, 1. So that is one of the stress management techniques that you can use in the moment. You can also use it to start your day clear and calm and peaceful. You can also use it to end your day with clarity, with calm and peace that will help you fall asleep better. So a little bit about stress. Stress is an evolutionary response. It's a state of mental or emotional strain or tension resulting from adverse or very demanding. Our bodies have evolved over time to have a response when danger strikes, right? So it is our hearts pumping faster because we have to move, the blood gets circulated, there's more oxygen to the brain, all our organs get involved in how do I get away from this danger or how do I face this danger? What happens is that that stress response, if the stress is chronic, which means that it doesn't go away, then we have really bad health outcomes. Because in a normal stress response, right? So you're driving down the street, kid runs in front of the car, you slam on the brake. You'll feel your heart start pumping really fast. You might be breathing shallow. You might have to even pull over on the side of the road. Well, in normal stress, between 60 and 90 minutes, it takes for your body to recover from that moment. It gets back calm, things re-regulate. If you're having constant stress, that doesn't happen. And the stress hormone cortisol builds up and creates all sorts of bad outcomes for the body. So some of the physical responses to stress I've talked about: breathing harder, breathing faster, you'll have a rapid heartbeat, strong contractions, you might have hypertension, so your blood pressure goes up, right? And sometimes you'll feel that lightheadedness. Gastrointestinal, you might have heartburn, diarrhea, ulcer, acid reflux, people get constipated. You might feel it in tension headaches. You might feel it here, muscle tension in your shoulders or in your back. Some people even grind their teeth and need a mouth guard because they're wearing their teeth down from the stress that they feel. You might even feel it in your reproductive system. Painful, shorter or longer periods for women, and both men and women might lose desire. Some behavioral outcomes: you might smoke or drink. You might eat more, eat less, or you might eat more junk food. You might find yourself sleeping a lot, or you might find yourself not being able to sleep at all and having insomnia. You might develop compulsive behaviors, or you might have poor self-care. You might also experience depression or anxiety. You might feel irritable or quick to anger. So here are some strategies for managing your stress. I talked about breath before. Here are some others. I want you to think about managing your media. So it turns out that human beings have a negativity bias. What that means is that we respond more to negative stimuli in more visceral ways. And we also hold on to those memories more powerfully. And some research has shown that it takes 4 positive experiences to counteract a negative one. So if you think about all the bad news that is on the news all day and what it would take for you to counteract that. So you want to limit your sources, you want to limit the amount of time you expose yourself to the news. I also recommend that you listen to the news or read the news and not necessarily watch it, because you're often not in control of the images that come in front of you when you're watching the news. And especially if you're a person of color and you are African American, you don't want to watch police violence. You don't want to watch people getting killed in front of you. It's a very traumatic events that will impact your mental health, and you will be feeling the impacts of that. So what I do suggest to people sometimes is that after you watch the news, watch something light. I don't know, cat videos, puppy videos, watch your baby, talk to someone you love. Find a way to counteract the negative. Another strategy is to go outside. It's really important for you to get sunshine on your face. It helps regulate sleep, but it also puts you in a positive mood. This is why people go to sunny places on vacation. It also helps you sleep. So if you can go outside to read, to work on your laptop, to have a conversation with a friend, or just to take a break. You want to find a way to calm your mind. So, a mindfulness practice is really important. If you have a faith practice, include that is a powerful way to counteract stress. So, prayer is a mindfulness practice. Some people are doing all the coloring books that are also a strategy that people are using for mindfulness practice. You can do yoga, meditation. For some people, it's creativity. You might want to paint. Whatever it is, find a way to calm your mind. You want to include exercise in your day. The minimum amount of exercise doctors recommend are 30 minutes, 3 to 5 times a week, and whatever that is. If you want to skip, run, walk, do yoga, bar exercise, aerobic exercise, whatever it is, find something you love and that you want to do, and do that. And really make sure that you give your body a workout. We live really, really sedentary lifestyles. There's a joke now that says sitting is the new smoking because of the impact that a sedentary lifestyle has on your health. You also want to connect with your loved ones. This pandemic, as well as the social upheavals that we're having, there's also fire that's going on, as well as earthquakes. There's just so much going on in 2020 that you want to reach out to people that you love and care about them in what they are going through. It turns out people with good social support systems live longer. Loneliness actually kills us. So make sure that you are feeling loved and cared about. Develop a gratitude practice. Oprah Winfrey made this really popular. And the science shows that if you are grateful, if you stay positive, and you can find things that you're grateful for, it it creates positive emotions. You have more hope. I will say that for me, this is one way that I don't have a lot of negative impacts from things that are going on around in the world, because I always focus on what is it that I'm grateful for? What is it that I have that makes me happy? How do I practice my own joy? How do I do things that make me feel good when things are going bad? And I always feel that things can always be worse. And I know for some people, they're like, well, that's relative and it doesn't necessarily work for me. But if you really think about how the fact that you're alive, the fact that you might not have had COVID-19, or you survived COVID-19, or you have people in your life who care about and who love you, and the small things that you achieve, whether through work or in the relationships that you have with people, and to show that gratitude to them as well, to say thank you to people, to praise the people. Um, I also think that to help you control, at least to develop a sense of control, to feel more control, is to have a schedule. Now, I'm really bad with this one. I tend not to have very good routines, but schedules are really important for you to feel some control over your life, but for you also to get done what needs to be done. So if you're in school, you want to, schedule study time. For everybody, you should schedule when you eat. Whenever that is, you really want to start with breakfast if you can. You want to schedule your exercise, schedule your sleep. If you're scheduling Zoom meetings, you want to schedule your sleep. You also want to take a break in between your various activities. You should not be sitting in front of a laptop for hours at a time. It's not good for your concentration. It's not good for your eyes. It's just not a good practice. Your body needs to move. Your brain needs a break. So remember to build in breaks of 5 to 10 minutes, say, in between meetings. And so I want you to think about what you will do to manage your stress. Now, a little bit about emotional resilience. Emotional resilience is actively and creatively adapting to stressful situations and crises. And what emotional resilience does is it helps you bounce back from things that happen to you, whether it's somebody who's dying, you have a chronic illness, somebody in your life has a chronic illness, you get laid off from a job, whatever it is, emotional resilience helps you to see the positivity. I know for myself, I got laid off 3 weeks ago, and my friends are all saying that I'm responding well, but I think of it as an opportunity to do something different, or I could be to do the same thing, but it gives me a break. And I'm able to think about, first, it's not something that I can control. So if you let go of those things that you can't control, you'll have a lot more peace in your life. Um, Take control of the things you can. I can't control looking for a job. I can't control getting a job. And so every day, you work towards that goal, but also give yourself grace in terms of, um, sorry, sorry. So the power of sleep. I want you to think about sleep as the ultimate energy drink. So it impacts your brain function, your moods, and your health. There's some ways to get good sleep. Prepare your space. You want your room to be dark. It triggers melatonin, which is your sleep hormone. You want it to be cool. You sleep better when the temperature is lower, calm, whatever that is for you. If you like white noise or you like music or you like it quiet and comfortable. You also want to make sure that you get between 7 and 9 hours of sleep. And I know people always brag, I only need 6. All I say is the science says that if you're great on 6, you're probably much better on 7 to 9 hours of sleep. So my thing is 7 is heaven, 8 is great, 9 is divine. Some things that interrupt your sleep are things like coffee and cigarettes. They are stimulants. So if you do have a hard time falling asleep, you don't want to use those things near bedtime. Alcohol might help you get to sleep, but it's really bad for sleep. You want to eat right. So the more nutrition dense foods that you eat, the better it is for your brain and your mental health and well being. Again, you want to make sure that you get 5 a day. Some of the hacks around that is if you have brighter colors in your food, you're more likely to have nutrition dense foods. The more colors you have on the plate, the more nutrition you're getting. Green the grub, I say, which is put green on your plate at all meals. And you get your 5 a day and finish with fruit. Another activity is also a way to build emotional resilience. And just so you know, some of the benefits of activity for brain function: enhanced creativity, improved concentration, and faster learning. So you want to really make sure that you get some activity in. Also helps build your immune system, which we all really need right now. So does sleep, by the way. So if you don't have a lot of sleep, you will lower your immune response and make you more susceptible. Some activity hacks: you want to do something you love, you want to make it routine, you want to try and integrate it into your day. So you might want to have meetings, etc., where you walk and talk. And again, you want to stay connected to people. Social support systems actually help people with cancer, with all sorts of diseases. It actually helps you get healthier faster. So it's a really good way to build resilience. So I want you to think about what you will do to build your emotional resilience. And I want to thank you for giving me this time to share with you my own story, as well as strategies for stress management, as well as building emotional resilience. Thank you.